I want to begin with a number, though, that is truly hard to process. 1 million. The White House says that is how many Americans have died from COVID-19 during this pandemic. Mothers and fathers, siblings, friends, gone. Good evening. I'm Leslie Foster. I can't believe we've reached this point. As we mark this milestone, cases are going up across the country and right here at home. Tonight, we're learning about new recommendations to wear masks inside and a new idea on Metro for those of us who still mask up. This got us wondering about whether these precautions are needed. John Henry is covering this story for us tonight, live from Prince George's County at the West Hyattsville Metro Station. John?
All right, Leslie, if you hop on Metro tonight, odds are you'll see a lot of people wearing masks, others without. Now there's a new idea from WMATA to give mask wearers their own rail car. Metro hasn't required masks on trains for a while now, but that doesn't mean the transit agency hasn't been thinking about where they belong on their trains going forward. At WMATA's Board of Directors meeting Thursday, one official asked if Metro had considered making mask-only cars.
A quiet car, like on the Amtrak. Has that been considered? I'm just curious.
Turns out Metro has thrown around the idea.
So that is something that we're actively looking into.
That comes as Prince George's County is recommending locals wear masks inside public places. The county's seen a modest increase in COVID cases over the last 6 weeks. Dr. Stuart Ray, a medicine professor at Johns Hopkins University, says it can still be beneficial to wear a mask even if others around you don't.
I just spent a couple of weeks on the COVID ward and was taking care of people with active COVID. And I know from the experience at Johns Hopkins and elsewhere that the mask I was wearing would protect me.
When it comes to evaluating risk, he says it all comes down to figuring out what you're comfortable with and not intentionally endangering others in situations where people may be vulnerable or where the chance of virus spread is high.
When I travel, I'm really careful about making sure I wear my mask the whole time. I don't do the peanuts on the airplane. I don't take the drink. I just ride the plane. It's like a lot of protection. It's multi-layer. When I get in my car, I put on the seatbelt. I know I have airbags and I drive defensively. And all three of those help me stay safer.
But Leslie, he adds, he's not surprised that people are taking off their masks, given that it appears that there's some immunity that's building up to the disease and that cases are milder currently.
You know, I noticed, John, that Prince George's County didn't come straight out and mandate masks like it may have done in the past. Does Dr. Ray think that mandates could come back?
He thinks it's unlikely given a number of things. First of all, those cases, as we were saying, are milder currently. On top of that, he thinks people are making better decisions as to where they should be wearing masks and where they shouldn't be. He only thinks that they would be coming back, mandates, that is, if there was a major development with the virus.
Every day we have to reevaluate our level of risk tolerance and what we are willing to do. All right, thank you, John.